Here we go, guys. Dr. Wade here, physical therapist with Physical Therapy and Balance Centers here in Louisville, Mississippi. We are on Physical Friday. We made it through the week. And for those of you watching on video, hey, I'm here at the beach. This is my 30th anniversary with my wife, Bethany. But we're coming to you with some wonderful information today about one of the top questions I've been getting over the last 2 weeks about exercise. Okay? And if you're over 15 and under 105, this will apply to you. Now, I'm going to turn this camera off my little ugly mug here so y'all can actually see where I am. We're going to give you a view of the beach, and then we're going to talk about exercise here, okay? Look at that. Isn't that nice? Somebody below us is playing some funky stuff, so hopefully that's not coming through too bad. All right, so here we go. So Scotty G has given me the microphone today. We are covering information about exercise. What kind of exercise should you do? Should you even exercise? Do you really need to? Where did this concept of exercise even come from? Why do we have to go make ourselves tired to be healthy, right? I mean, let's face it. Who wants to get up in the morning, or who wants to get up in the middle of the day or the afternoon or the evening and go, all right, let me go exhaust myself, right? That's the way some of you feel. I know it. I've heard it. I've heard all your questions. I know your concerns. Again, I've had over 17 questions in the last 2 weeks about exercise. What kind of exercise should I do? How do I do the exercise? I don't want to join a gym. I do want to join a gym. I'm not getting enough help at the gym, and when they help me, it hurts. Or I feel like I'm exercising and I'm not getting anywhere. I'm trying to exercise like these young guys are, and I'm just not getting anywhere. I literally had a guy that's over 70 years old tell me, I've been watching your son. This is when my son came into town, went to the gym. He said, I've been watching your son. He's real motivating. He keeps me going. It gives me hope. And I'm sitting there going, no, wait a minute. All right, this is a 70-year-old man watching a 20-year-old work out and then try to do that same thing. Now, wait a minute. We have to clear some things up about exercise. And let's cover some real information here, some things that'll really help you, whether you're female or male, and especially you ladies, please listen, because we all hear about osteoporosis, we hear about arthritis, and we also have these concerns about, hey, let's be a lady here. Ladies don't sweat. Some of the older generations, they didn't want, that was another thing. How can I exercise without sweating? I'm like, well, you can do it, but sweating is kind of a healthy thing. I'm sorry. But, there are these ladies that still put the full complement of their makeup on to go to the gym, and they don't want to sweat it off. Okay, I understand that. That's a modern day thing. It is. Our ancestors, let's just go back in time for just a half a second here and talk about our caveman ancestors. They did not in any way have any kind of problems like what we're dealing with. In fact, they would probably be laughing at us seeing us run on these treadmills and we're just running in place and there's nothing chasing us and we're not chasing down anything. I want you to think about that concept for just a second. Think about the Greek statues, what those guys look like, what the ladies look like. Those were super healthy people, right? And they weren't really exercising per se, but they were very active and they handled a lot of resistance in their daily routine of either cultivating, acquiring food, hunting it, whatever, or just living their average everyday life. There was a lot of resistance to their muscles and on their joints. And the way God designed us is pretty fascinating, if you ask me. The way our bodies are shaped, like what you see in the mirror right now, is basically a reflection of what you've been doing over the last 3 months with your activity, your rest, your food, your sleep, your sun exposure, your activities in general. So can you change that? Well, absolutely you can. So what are some good basic practices? We're talking about exercise here. That's just one thing. That's putting back in the necessary amount of activity, the necessary amount of resistance on your muscles, the number one most important tissue in your body, in my opinion. Yeah, I'm going to even say it's even more important than your brain. For today's discussion at least, okay? Just go with me on this. Because without that muscle, you can't move very well. And when your muscles deplete, you have higher levels of inflammation. You have greater levels of ill health, metabolic health problems, like diabetes, heart disease, coronary artery vascular disease, stroke. Yeah. Muscle's important. Now, if you have too much muscle, like a bodybuilder or a strongman, well, that can cause some problems too. They have their own set of problems. But there's this middle road where your muscles are just strong and you feel good, you move well. You get out of bed in the morning, you don't feel those aches, pains, and creaks, and you don't feel like it takes you 10 to 15 minutes just to get going. That's when your muscles are doing great and your joints are being treated well. If your joints are wearing out, that means the muscles around them aren't providing shock absorption. Do you realize that your muscles are also considered shock absorbers, like around your knees? Like the thigh muscle, the muscle on top of your thigh, when it gets weak, it allows more shock. Every step you take, when you take a step, when you're walking, each step, when you take those steps, the shock of that impact on the ground should be spread throughout that muscle if it's doing its job, if it's strong, in your thigh. But when that muscle gets weak, it gets inside the knee, in your joint, and it breaks down. And that's when you get knee arthritis. And that's when you go to the doctor, and then they give you some Celebrex, or they give you some Meloxicam, or some Mobic. That does not mean you have a Celebrex deficiency, a Mobic deficiency, or a Meloxicam deficiency. That means you have symptoms that are causing you pain, and your physician is trying to help you feel better. Eventually, you have to do something that corrects the problem that led up to that. Exercise can be part of that solution if you do it right. So let's talk about how to do exercise here. We've got about, we've got several more minutes here. We're going to help you out a lot. Now, this is not something you need to go run out there right now and go and hog wild with. I highly recommend you speak with your physician or nurse practitioner first before you start any change in your health routine, because there are considerations, especially if you're on medication or if you have any type of medical issue. Before you start any type of exercise program, then yes, you need to get checked, okay? A lot of people think they can just self-doctor and play with their own medications and play with their own health. I do not recommend that at all. The highest trained people are right next door to you, and they can help you out, including your physical therapist. Now, that's what we do in physical therapies. We work on your physical health. We work directly with your physician, however, to make sure your medical health is in check, okay? So let's get down to it. How much exercise do you really need to do? So first of all, it starts with a little bit about your age, okay? So yes, the younger you are, the more you can really put a lot of load on your system. As you get older, you don't need near as much load. But let's do an average. Let's say this works for everybody. I'm about to give you one of my big secrets here, okay? This is a routine. This is a method that anybody can use, even if you're 100 or you're 15. And this is not only going to help you get stronger, but it helps you maintain muscle, okay? You won't lose any for sure. It only takes 20 minutes or less, and you can do it every single day, okay? Every single day. You sure can. You've probably learned that when you work a certain muscle group, you got to let it rest, 72 hours or so before you can work it again. Well, there are some methods that provide for that. I understand all the split routines and periodization for those of you exercise fanatics out there. My son is a he is a CSCS, a Certified Strength and Conditioning Specialist. He is into all of that. He knows all the biohacking tricks and everything. As a doctor of physical therapy, yes, I fully understand those things, have used them myself. I used to do periodization programs all the time. Now, what I do is I base it on the individual's needs. And that could be, you could be a lady that's 47 years old and you've never exercised before. You could be a lady that's 35 years old and you do, half marathons all the time. Or you could be a man who is 51 years old, former football player, former athlete, and just have some aches and pains in their neck. And every time you try to exercise, it tears your shoulders up. Things like that. These are common things. We see this every day in our practice. And so my job is to figure out a way to be able to get you to exercise, the number one most valuable thing you can do for your muscle, exercise, to get them strong and to help keep you moving well. When your muscles are strong, when your muscles are healthy, you are healthy. You feel better. So 20 minutes and less, what can you do? You walk into the gym. or you walk into the part of your home where you have your weights. That's the number one thing you need. You need a set of adjustable weights. You can use those resistance bands. They're okay. You might need some help with that, like get with a trainer, a physical therapist, to help design a good routine as far as body position. It's very simple to do with weights, though. When you have dumbbells that range anywhere from all the way from 1 pound, I'd say about 3 pounds up to around 50 for the men. And some of the pretty strong women. I've seen a few that'll work around in the 30-40 range. And here's another myth, my friends. Women, when they do strength training, do not get thicker, bulkier, bigger thighs, bigger butts, and all that stuff. No, they do not. No. That's a myth. The more strength training you do, the more lean your muscle gets. It's when you eat too much that you get the big bellies and biceps, okay? When you get big, it's because you are eating too much. You're eating more than what you're burning. It's simple as that. Now, that's a whole nother topic for another day. As far as exercise goes, I'll tell you this, though. You cannot out-exercise a bad diet. Nope, you can't. So if your diet's bad, well, then it's bad. I mean, you're just not, you'll get stronger, but you're still going to feel crappy, and you're still going to have adipose tissue, some extra fat on you. And yeah, you'll seem to get quite big, And in our profession, we have this expression about big bellies and biceps, and those are the men typically that get in there. And I just saw it just a second ago, literally in the gym here in the hotel room. This guy is cranking his arms. I'm talking probably about 6 sets on his triceps, and he's in his 50s, close to 60s. And he probably did about 6 sets on his biceps. That's all he did, worked his arms. And they were big. I mean, I was impressed with that. But I mean, then you look at his whole physique, and you can tell he's got a lot of wear and tear on him. And yeah, his belly was quite sizable. He probably had about a 37-inch waist. Okay, so if you really are into that, that's fine. But I do not recommend isolating exercises like that. The type of exercise I really want you to think about in terms of health is whole body exercise. So you get in there, you got your resistance ready, you got your weights, your dumbbells. Okay, and so what I want you to do, and again, before you do any exercise, you're always talking to your healthcare practitioner, right? So you get that weight, and you're going to work your large muscle groups first. Think about squat maneuvers, okay? Any type of squat maneuver, like bending down and standing up. And if you want to get things done pretty darn quick, what you can do is you can take those weights, set them kind of like on your shoulders, like you're holding the weights on your shoulders. And then you do a squat maneuver, and as you stand up, you press them up. We call it a squat press. That way you're getting shoulders, you're getting some of your chest muscles, you're getting your back muscles, you're getting your hip muscles, and your leg muscles all working together as one. We call that a compound exercise. Okay? That's one of my favorite maneuvers. Another one is the simple, basic push-up. How many push-ups can you do? If you're a lady, you can do them from your knees. Okay, you should always try to build on your push-ups. Okay, what about a press-up? Or some people call that a dip, a chair dip. Like if you're sitting in a chair with arms on it, okay, you don't need a weight for this. You can simply press your bottom, grab the arms of the chair, keep your elbows in close by your side, and push your body up using your feet, maybe for balance on a stool in front of you, or just keep them on the ground. We call that a dip or a press-up, a sitting press-up. How many of those can you do? You should be able to do around, if you're a lady, around 10 push-ups. If you can't, work up to that. Around 8 to 10 dips. If you can't do that, work up to that. That means you're getting stronger, getting healthier. The weaker your upper body, the greater your chances are for developing cardiovascular problems. That is good research. And that is men and women. Good, strong upper body comes from, simple push-ups. You cannot beat a push-up. And you can vary the push-ups. You can do narrow push-ups. You can do wide push-ups. Okay? You can do standard push-ups. You can look up online how to do a push-up challenge. You can go into what are called Hindu push-ups. Those are awesome. Those are pretty advanced. All right? And then your dips from the chair. You can do those chair dips. They're awesome. Those are pressing maneuvers. Okay, now here's where you might need some equipment right here on pulling up. Now, there are ways you can adjust a towel around a doorknob, but I do recommend having a pull-up bar or a set of rings for your house. And in that way, you can use assistance at first and then eventually do an actual pull-up. And I will say this, I don't know if I can say her name or not. I need to get her permission. But I know a 65-year-old lady, well, she was 65 at this time, and she could do over 10 pull-ups. Okay? And she worked for it, and she felt great. And she moved well too. And now I believe she's in her 80s now. But I'm going to get her permission because I'd like to talk with. I'd love her to talk with y'all one day. But yeah, your age, your biological age is your biological age. But your chronological age is your chronological age. You're going to get older. But as you get older, can you get stronger? Absolutely. You can always improve on something. Exercise is one way to achieve that. The more load you put on your muscles, the stronger they will get. One set, whole body, 10 to 15 repetitions, working your large muscles to your small muscles. Small muscles are like when you stand up and do what are called curls. You grab the weights and you curl them up towards your shoulder with your palms in the up position. That's one way to do it. Another thing is just simply where you are doing try what are called bent rows, where you bend over, keep your back straight, and you pull the weights up towards your chest. Okay? Those are all compound, strong movements that involve so many muscles in your body. One set, 10 to 15, you should not feel exhausted when you're done. You should feel good. If you're in a gym, you can go to the leg unit and do the leg kicking maneuver, the leg extension. Then pull the unit down, leg flexion. Okay? You can do the squat press. You can do the bench press, or a machine that presses forward and then pulls back. And then you can do the lat pull, where you pull down and then you grab some weights and then you push up, working all your large muscle groups. You push, you pull, you squat, you press. Work your whole body, no more than 20 minutes. And then you walk out. You are done. You should feel fairly invigorated, like you have done something good. If you feel fully exhausted and stressed out, then you overdid it. If you feel like, well, that was a waste of time, you probably need to add a little extra weight. Keep the repetitions between 10 and 15. You can also get with the trainer, get with the personal trainer who's there, and say, hey, I need a whole body routine. It's not going to take more than 20 minutes. I want to work all muscle groups, 10 to 15 reps. I want to be able to come right back in and do it tomorrow. If they say, oh, you can't do that, then tell them to call me. Dr. Wade at Fyzical, 773-3700. I'll be glad to talk to him and educate him. Or you can. So I hope that makes sense. That is the number one way to exercise, to grow strength, to maintain strength, that you can do every day. It's probably the healthiest high-frequency method I've ever seen for muscle tissue that'll keep you healthy, keep you feeling good. You've accomplished something. You're not going to lose. You're not going to get weak with this. You will not grow weaker. You will not. And nobody has ever come in my clinic and said, Dr. Wade, I was just too strong. They usually come in saying something the opposite, like, I'm too weak. I can't do this. I can't keep up with my grandkids. I'm out there trying to run around and I just get exhausted too quick. I can't get up and down out of the chair. When I get on the ground, I need help getting up. That's what exercise is for, is to keep you strong. If you cannot sit and get off the ground without using your hands or propping on one knee or getting somebody to help you get up, you need some help. I don't care how old you are. You should be able to do that. You should be able to sit on the ground and pop right up with no help. If you cannot, get with your physician. Talk about some things that you can do that can help that. They should be referring you to your physical therapist that can help you get strong where you are weak. And then you can take over and do the routine that you and I were just talking about, a whole body routine that can be done every day to every other day. Keep it comfortable, keep it enjoyable. The best exercise in the world is the one that you will stick with, period. That's it, my friends. It's been almost 20 minutes. I hope I've given you some good information. This is Dr. Wade coming to you from the beach on Fyzical Friday, and I look forward to seeing you next week, where we will be doing a good giveaway, so be sure to stay tuned. I can't wait to talk to you next week. Get out there, start developing your exercise program. I look forward to hearing from you. These are some exciting times with us on here at Physical Therapy and Balance Center, as we've helped so many people with this type of routine before, and there's a lot of you out there that know who I'm talking about, and y'all have done great, and I'm proud of you, okay? So I will see y'all next week. Meanwhile, stay strong, stay healthy, keep moving, keep that good balance. Give us a call if you need some help, 662-773-3700, Physical Therapy and Balance Centers, and Red Hills Orthopedics. Take care, my friends. See you next week.